All right, welcome everyone. Thank you so much for joining us. Welcome back. It was just last Thursday when we saw you. So you are now here for session 14. Can you believe it? In our 2024 community webinar series, where we're focusing on empowerment through education. I'm Julia Wood, the Director of Professional and Community Education here at the Lewy Body Dementia Association. We started off this series, if any of you all remember, way back to like January, focusing on the power of purpose and how that supports quality of life. And today we're going to be joined by my dear colleague and occupational therapist, Rachel Wiley, to learn more about how to support engagement in meaningful activities to really help you facilitate and foster that engagement in your purpose in life. Before we get started, a few words about the Lewy Body Dementia Association. We are a nonprofit dedicated to optimizing the quality of life for those affected by LBD. We provide comprehensive education for the community and professionals in events like this, deliver compassionate support for those living with LBD, and strive to advance awareness and research. So a few housekeeping items before we get started today. You notice at the bottom of your screen, you have a toolbar, and on that, you have an option to show captions. So you can select that at any time during the presentation to launch the closed captioning feature. There is also, if you notice, a resources tab that you can click on. And that icon will have links that you can click on or even resources that accompany today's session for you to explore. And then you're welcome to submit your questions at any time throughout the presentation using the Q&A icon. Following Rachel's presentation today, we're going to address a few questions from the audience Q&A poll. All right, so some exciting news. I think this is the third webinar we've had since this happened, but just to make sure you know that there is a ribbon now dedicated on our homepage that will direct you on our website where you can register for upcoming webinars and also find the link to our YouTube channel to watch any recordings of our past webinars. This presentation is also being recorded, and an email will be sent to those who registered with a link to view the recording in about a week. And you'll also have links in there as well for different resources that we talked about today. Lastly, when you leave the session today, a brief survey will appear asking for your feedback about today's presentation and content. Please take a moment to complete that survey to help inform our future content. We're now planning for these events for 2025, so help give us some ideas, will you? Now, let's learn more about who's joining us. You know about who we are now, so we want to know who's in our audience. And Rose just traveled through 4 cities to get here. She's actually downstairs in my living room. And so we've got our polling question up asking who is with us today. It is, you can choose multiple options if you have both a person with Lewy and a care partner there. And so we also have the option for a former care partner, healthcare providers, family and friends join us often, and also researchers and scientists. So let's check this out and see who's in the audience. Okay, so looks like we've just got a few more seconds here. Care partner, you guys are always with us, and I think that this is really going to be of interest to you today a lot in learning how to support people that in your life are living with Lewy. But for the person with Lewy too, I think there's going to be a lot of takeaways in how you can adjust and adapt your environment or a task to be more successful within it. And then healthcare providers, thanks so much for joining. We hope that you get some ideas that you'll like too. So it looks like we've got about almost 60% care partners, and then we've got almost 20% of our audience are people with Lewy. We've got about 5% former care partners. We have 21% healthcare providers, and then we also have 12% are family or friends of someone with LBD. And then we just got Zoom bombed by our own amazing colleague from our research division. All right, you guys. So with that, I'm going to introduce our speaker. Now that you know about me and LBDA and our speaker, you can kind of see, learn a little bit more about who you're going to hear from today. So, Rachel Wiley is an occupational therapist and the founder and owner of Dementia Consulting and the Dementia Collaborative, LLC. Rachel is a certified skills to care for care partners of individuals living with dementia, and she is a certified skills to care master trainer through Jefferson Elder Care. Previously, Rachel was an adjunct faculty member in the occupational therapy departments at Thomas Jefferson University and Temple University. She has also worked as an occupational therapist and dementia service coordinator for the Pew Charitable Trust Grant with Jefferson Elder Care. She previously served as the gerontology chair for the Pennsylvania Occupational Therapy Association's District V Board. And Rachel has been working with individuals with dementia in her personal and professional context for over 17 years. So please use your reactions button, which I hope we have, yep, down at the bottom, to give a warm welcome to occupational therapist Rachel Wiley. Hi, Rachel.
Julia, thank you so much for having me today. I'm really excited to be here.
Oh, absolutely. Thank you so much for joining. And look, they're pretty excited too. We already got some reactions going off here. So, with that, my dear, I'm going to leave you to it and go in the backstage, but have a great presentation. I'll see you after for some questions.
Thank you so much, Julia. And thank you all so much for joining me today. I'm just going to share my screen so that you can see the PowerPoint and lots of things going on my screen. Hopefully everyone can see me okay. If, if for some reason these slides aren't showing up backstage, just let me know. All right, so thank you again for joining me. I really appreciate the kind and warm introduction. I'm really excited about this topic. If you couldn't tell, this is something I'm excited about, both professionally, but also personally. So this is a picture of my mom. My grandmother did pass away with dementia. It's unclear exactly what type of dementia she had. I believe probably a mix between maybe vascular dementia and maybe Alzheimer's disease. But I am going to talk specifically today about activity engagement and how we can adapt it to support those living with Lewy. All right. So I also would love to know a little bit more about all of you. So Rose backstage is kindly going to put a couple of polls up. So the first one that's going to show up is, what do you hope to learn today? So you'll have an option to select a few of these. So we're going to talk about strategies for some daily living activities, strategies to support engagement in leisure, strategies to support social engagement, or, you know, if there are some other things that you're hoping to discuss. I'm going to do my best to talk about all of these topics today. And again, you do have that Q&A feature as well. So if there's anything that you have burning questions about that I wasn't able to address, you can feel free to put it in there, and I'll do my best to address as many questions as I can at the end. All right, so I'll let you all kind of continue to answer the question, but it looks like we have a pretty even split here. So we're going to talk about all of these things. I'll make sure we talk about daily living activities, leisure activities, and social engagement as well. Great. Okay, and then I have another question for all of you while I get to know who's in the audience. I'm also interested in, what is your biggest perceived barrier to activity engagement? So is that cognitive abilities? So that might be things like attention span, memory. Is it daytime sleepiness or fatigue, apathy? We can kind of put in there as well. Hallucinations or delusions. Sorry, we're going to put apathy and changes to mood. So depression, apathy, and anxiety. Or is it movement challenges? I appreciate you all taking a couple minutes to answer this. Okay, this is really helpful feedback. Again, I'm going to do my best to try to address as many of these as possible. I know we only have a little over an hour together, so I might not be able to get to everything in as much detail as I'd like, but I'll try to touch on everything to at least some degree. And please continue to answer that poll as I go here. I'll keep checking on it. So it looks like cognitive ability is probably the highest priority here. And then we have changes to mood. So depression, apathy, anxiety being the second, fatigue, sleepiness being the third. But again, I think all of these are things that we want to discuss. That sounds good. All right, everyone. Oh, and I should also say too, oh, it looks like my pictures aren't showing here. That's strange. I thought that I had fixed all my glitches, but maybe not. So if there are a few slides where you can't see pictures, I'll do my best to describe, but we're going to cross our fingers that my tech decides to work. Okay, so what are our learning objectives today? So the first one is I'm hoping that by the end of today, you'll be able to describe the benefits of maintaining engagement in meaningful activities for people living with Lewy body dementia, that you'll be able to demonstrate various strategies one can practice at home to support safely engaging in activities of interest, and identifying tips and tricks that people living with Lewy body dementia and their care partners can utilize to support continued engagement in meaningful activities as the disease progresses. Okay. All right. So, and again, I had a couple pictures on there, but I didn't mention. So my grandmother had dementia, but also two great aunts of mine also had dementia. I used to have a patient care practice that was called Day by Day Home Therapy, and that was named in their honor. Their maiden name was Day. So I really got to see firsthand some of the difficulties and challenges that my family went through when it came to dementia, whether it be some behaviors or challenges with activity engagement, but then I've also seen it in a professional context as well. So I'm really passionate about this topic, and I'm hoping that all of you feel like you gain something by the end of the webinar today. So a little bit of background about why it is that we talk about this. So we know that family, friends, and other unpaid caregivers or care partners do provide the majority of the hands-on care and assistance to people who are living with dementia. We also know from research that challenging, I'm putting behaviors in quotes here, challenging behaviors are reported to be one of the most challenging aspects of caregiving. But again, we also know that meaningful and purposeful activity engagement consistently is shown through the research to decrease challenging behaviors. So it's one of the many reasons that we focus on this topic. A few other reasons that we talk about activity engagement. So meaningful and purposeful activity engagement, again, it can reduce behaviors, but it can also reduce things like depression. It can reduce agitation, anxiety, aggression, fear. And again, that goes for people living with dementia, but it also goes for people living without dementia as well. And this is really important because we know that a lot of the pharmacologic approaches or medication approaches that are available for behaviors either have side effects, or there may not be a medication available to treat some of these behaviors. So for example, if my family member is shadowing me or following me around the house, I can't go to the doctor and say, I need a medication to stop him from following me around the house. Right? That doesn't necessarily exist. However, we can focus on meaningful and purposeful activity engagement, and that can help reduce that behavior. Again, I'm not anti-medication by any means. We need pharmacologic approaches and medication, but we know when it comes to behaviors that activity engagement is just as effective as medication and doesn't have the same level of side effects or the same volume of side effects. We also know that activity engagement can potentially reduce care partner time spent on duty. So what do I mean by on duty? I mean the time that's spent kind of managing those day-to-day challenges. So if someone's anxious, for example, or someone's, again, following you around, maybe they're agitated, that caregiver needs to often spend a lot of time supporting the person living with dementia to help reduce some of those challenges. However, if we can maximize activity engagement, we can reduce time spent on duty. Right. I hope that all makes sense. And then a few other benefits to activity engagement, and these are some of my favorites and ones that I really want to highlight. We know that meaningful activity engagement can provide a sense of purpose and help to increase quality of life. It helps us capitalize on lifelong social roles and interests. So how do we identify ourselves? What are our roles? For me, it would be I'm an occupational therapist or I'm a dementia practitioner. Those are things that I identify as and are important to me to maintain regardless of my level of cognition. Activity engagement also helps provide a sense of relaxation. It can help with social stimulation. And this last point is one of my favorite points that I try to make in any presentation I do, which is that all of us as humans, have an innate or internal desire or need to participate in the world. And that does not go away with dementia. We all have a desire to participate. So it's just a matter of changing what participation maybe looks like. And that's really what we're going to focus on today. All right, so what does change? What do I mean when I say changes to activity engagement? So these are some things that I might hear from care partners. They might say something to me like, well, my family member with Louie, they used to wash the dishes, but he just doesn't do it now. Or she tells me she wants to do a puzzle, but then she never does. Or he used to read the newspaper and now he just glances at it and then puts it down. Or maybe every time I ask if she wants to do the craft with me, then she says no. So what exactly changed? Why are we seeing these types of phrases or responses? So we see a couple different things. One, the ability to initiate or start a task may now be difficult for someone. The task itself may now be too complex or too challenging. It's also possible that the ability to sequence or follow a particular set of steps might also be a bit tricky. So this is why it's important for all of us as care partners or people living with Lewy to understand how we might be able to select appropriate activities, but also how we can adapt them to really enhance or maximize engagement. And I'm going to give you concrete ways to do that. So just bear with me a little longer. Okay. Ooh. Sorry, everyone. Choosing activities. Again, some of my graphics went away, but I know they're in the they're in the PDF that you can download. So you can see them there. All right. So choosing activities. What do we need to keep in mind when we're selecting activities? I mentioned this briefly already, but I just want to highlight this again. When we are thinking about what activities can we come up with for someone to engage in, we want to think about capitalizing on lifelong social roles and interests. Meaning, I want to think about what did that person either do for work or how did they spend a lot of their time? What were different tasks that they typically engaged in on a day-to-day basis? We also want to make sure that we're shifting the purpose. So the purpose is engagement and enjoyment, not the end product. So sometimes I'll say process over product. So what do I mean by that? I mean that if we're going to use an activity like washing dishes as our meaningful activity engagement, then it means that I don't care whether or not the dishes are perfectly clean at the end, because that's not what I'm using that activity for, right? I'm shifting the purpose from end product of clean dishes to the process, which is engaging in the task of washing dishes. So if I am a care partner and it's really important to me that those dishes are perfectly clean, then maybe that's not the activity that I choose to engage in with my family member. Maybe I'm going to pick something else. Same sort of thing we can think about, folding laundry, for example. If it's really important that that laundry is folded perfectly, maybe we don't pick that for our meaningful activity engagement. So we just want to be thoughtful about what the activity is and what our goal is, which is the process enjoyment. We want to keep safety in mind. I'll talk about some safety tips here in a bit as well. When in doubt, we want to choose activities that are repetitive and familiar. So I'm going to talk about this in a moment as well, but one-step repetitive movements or actions are going to be appropriate for many different cognitive levels. So oftentimes we choose those types of activities. And when possible, we want to try to fit the activity into the person's established routine. Okay, so a setup activity versus one that will require constant assistance. So again, when we think about choosing activities, this will also depend to some degree on cognitive level. And again, I'll talk about that momentarily. But when possible, it's always helpful to care partners if we can come up with an activity that we can get started with our family member living with dementia. We can, start to get the items out, get them engaged in the task. And then once they get started, we might be able to walk away for a few moments while they engage in that task. versus other tasks that may require kind of our constant supervision or support. So when possible, sometimes it's less work for a care partner if we can come up with those setup activities. And then we also want to be really thoughtful about the physical abilities of the person with dementia. So when we're choosing activities, we want to think about, what's the person's fine motor control or coordination? Do they have tremors? What's their vision like? How is their hearing? What is their strength and balance? All of these are going to be important considerations so that we come up with activities that are A, safe, and B, that are good fit that someone can enjoy and again, maximize their participation. Okay, and I definitely want to spend a few moments talking about cognitive levels because I think that that's really going to set some important groundwork for us here when we're thinking about how to choose activities. Okay, so Allen's cognitive levels. This is a model that's, it comes out of the occupational therapy world. So Julie and I have some familiarity with it. I know it's not used in a ton of other environments, but I do still think that the premise of this model can be really, really helpful for care partners to understand. So I'm just going to break it down kind of simply right now, and then we'll go from there. Okay, so in this model, we have 6 different levels. So a 6.0 would be me on a good day, when I'm not tired, when I'm not stressed, when I have no cognitive impairment, I would be functioning at a 6.0. Then we get into the level 5 range. So every level from here on out has what we call modes. So you'll see a 5.8, 5.6, 5.4, 5.2, 5.0. I'm just going to group them all together for the sake of education today. So a level 5 is what we would call more of a mild cognitive impairment. So these are my clients who they're still safe to live at home alone with dementia. But again, they're displaying more of a mild cognitive impairment. They might need help with really complex tasks. So for example, if they needed to, I usually use the example of planning a dinner party. If they needed to plan a dinner party and coordinate, a guest list, and they have multiple items that they're preparing in the kitchen and they need to get the timing right so that it's all ready at the same time. That's a pretty complex task. And so they would need assistance for something that complex. Other things that are complex, things like managing money, managing medication, driving, those are all more complex tasks that someone may need some assistance for. Okay, then we get into the level 4 range. So again, 4.8, 4.6, 4.4, 4.2, 4.0. I'm grouping them together here. We're calling this level 4. These are clients who are considered goal-directed. This means that they can conceptualize or understand the end goal or the end task, if you will. So if I use brushing teeth as an example, so somebody who's goal-directed, they understand the concept of brushing teeth where they know that the end goal is that my teeth are all going to be clean. It means when I brush my teeth, I'm going to brush the left, the right, the front, the back, the top, the bottom. And when my teeth are all clean, then I stop brushing my teeth because I know that that was the goal, to get my teeth clean. Versus when we look at a level 3, someone who's functioning at a level 3 level, manual actions. This is a repetitive manual action. So when they're brushing their teeth, they probably need a little help to get started, and they can physically brush, but they're probably going to hang out on one side of their mouth for a while, right? They're going to brush back and forth, brush, 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 because they can engage in a repetitive and manual way, but they don't necessarily understand that end goal, which is that their teeth all need to be clean. So they're going to need some cueing or assistance from us to say, okay, now we need to move the toothbrush to the other side of our mouth. So, got to get the left side, or got to get the top or the bottom. It's also possible that they'll brush for a while, even once their teeth are thoroughly clean on that side, or they might stop brushing before their teeth are clean. So they no longer necessarily have that goal-directed component. I hope that that makes sense. So if I apply this to a leisure activity, so let's say jigsaw puzzle. So level 4, somebody can understand the end goal of a jigsaw puzzle, right? We want to put all those pieces together and try to complete a puzzle. It might be difficult depending on some other factors. Again, we'll talk more about that today as well. But they, again, conceptually understand that we want to put pieces together to create a picture or a puzzle. Somebody who's functioning at a level 3, they can still engage, but it looks different. They don't necessarily understand the abstract concept of putting pieces together to create a picture at the end, but they can repetitively and manually engage. So they can take those puzzle pieces out of the box. They can help clean up and put the puzzle pieces back in the box. They can flip the puzzle pieces over so the bright, colorful side is facing up, right? Those are repetitive manual ways for someone to still engage in a task, even if they don't understand that end goal. Okay. And you can see here, I also specified because many clients living with dementia fall in this either level 3 or level 4 or level 3. Attention span also comes into play here. So at a level 4, the absolute maximum attention span that we're looking at is an hour. And I would say that's, again, some great circumstances to make that happen. So an hour is really the max under perfect conditions. And level 3, the maximum attention span that we see is 30 minutes, and that's under perfect conditions. Okay. Level 2, so this is what we call postural actions. These are my clients who are really sensory oriented. So when I say that, I mean, when we talk about brushing teeth, they might be my clients who are biting down on the toothbrush or sucking the toothpaste or the water off of the toothbrush. They need a lot more assistance for some of their activities of daily living. For a puzzle, they can hold the puzzle pieces, touch, feel them. Somebody can talk to them about what's on the puzzle, what's the content, what are we looking at, what are the colors involved. But again, sensory oriented. Okay, and then level 1, this is what we call automatic actions. This is typically when we're looking at more end of life. These clients are responding more to internal or often painful stimuli. So again, I'd like to kind of give everyone an overview here because I think it can be really, really helpful to have a sense of where is my family member functioning so that I can adapt the activity to meet them where they're at. And, I know I've said this to, I think I said this to Julia and Rose before, the challenging part when we think about Lewy body is that this can change. This can change day to day. It can change hour to hour. It can change minutes to minutes. And so you all as care partners have an exceptionally challenging time because not only do you have to adapt activities to meet your family member where they're at, but you have to adapt activities fairly regularly because where they're functioning could fluctuate pretty drastically. So they may wake up and they're more in a manual action stage. And so when you're supporting them with brushing their teeth, you really are giving them a lot of cues to kind of go back and forth and make sure they're really thorough with brushing their teeth. But maybe by the end of the day, they're more at a level 4. They're goal directed. They're functioning a little bit better. They've had their medication. They've been exercising, up and moving. And so that you don't need to provide as much assistance. And they can brush their teeth without as much cueing. So we want to be really observant as someone who's supporting someone living with dementia so that we can make modifications, again, as appropriate to make sure our family member can engage to the best of their ability. Okay, I hope that all makes sense. If you want some clarification, again, please feel free to put that in the Q&A, and I would be more than happy to try to clarify some of that at the end of today's webinar. Okay, so I do want you to try to consider everything we just talked about when choosing activities. Now I'd love to give you some examples of what are some different activities that we might think about. So I broke these down. We have a few different slides on this. These are just some very general examples. This is not an all-inclusive list. So we have leisure activities. These might be things like knitting, listening to music, looking through photographs, coloring, looking at magazines, a rummage box, which I'll talk more about in a minute, puzzles, lacing. And again, we can think about how can we make adaptations to match cognitive level? How can we make adaptations to match physical functioning? So for example, if somebody maybe has visual impairment and hearing impairment, maybe they can still feel vibration of music. And so maybe they can still tap along to the music as they feel the vibration, right? So we can be creative in how we think about making these adaptations to still meet their needs. Maybe knitting would be really challenging for somebody who has arthritis or pretty significant tremors. But let's say they're at a manual action stage, so a level 3, repetitive, familiar activities. So maybe they would love to help us just kind of ball up the yarn to help it get organized and put it in the basket, right? So again, thinking about what's familiar, what's important to them, and how can we make those adaptations. Okay, we can also think about sensory activities. So I have a twiddle muff or an apron as an example. Again, I have some pictures. I'm crossing my fingers that my pictures show up. Other things like petting a dog or a cat. You'll see in the resources or the links section of your resources, I put in there a few different links, which I'll chat about later. One of them is Joy for All Pets. They are a robotic pet. They have very lifelike cats. I just want to make sure I kind of give the disclaimer, I can't say for sure whether or not that might be a potential trigger for someone who has hallucinations. So just be aware of that before you explore that option. But I have had some clients who have had a lot of success using robotic pets, particularly the cats from Joy for All. Also thinking about theraputty, or sometimes we call it thinking clay. So things like Play-Doh or Silly Putty, they can provide some really great sensory input, tactile input. I don't know if you can all tell, but I talk with my hands a lot. So I often have my own, it's called thinking putty. So I'm often playing with thinking putty while I do presentations or chats as well. Other activities we can look at include social activities. So phone calls or video chats with friends and family, offering a friendly visit, going out to eat. We also can look at household tasks. So I've used some of these as examples already, folding laundry, washing dishes, wiping the table or dusting, even things like sorting. So sorting silverware. I've had clients where, I've showed up to their house and said, these nuts and bolts from my toolkit got all mixed up in my trunk on the way over. Could you help me sort them? So we can use sorting and sorting familiar household items as a meaningful activity as well. Also, physical activity, I won't go into a ton of detail about that because I know you've had some other fantastic guest speakers like Jennifer Brown, physical therapist, who's talked a bit about some more physical activity. But things like walking, dancing, exercising can be really beneficial as well. Okay, some additional examples, because I know you might be thinking, okay, Rachel, you're using a lot of examples for someone who has maybe more significant or advanced cognitive impairment, but what about my family member who, they only have mild cognitive impairment, or for the most part, they're functioning independently and only need assistance here or there. Here are just some general ideas for activities. Again, we can make adaptations for any of these depending on the person, but these are maybe more activities for someone who has more of a mild cognitive impairment, more functioning at that level 5 or a higher level 4. So I used my current life as an example, some things that I know my current friends and family are doing that are meaningful to them. So up here in Vermont, there are a lot of volunteers who work with refugees in the area. I also have a family friend who's been volunteering to help people with the bike ferry. So helping people get on and off the bike ferry. Habitat for Humanity Restore, so helping sort different items. for that to put on the shelves or to price, working at the farm stand, possibly even doing interviews. So connecting with local students, either as a mentor. And then I believe Rose had put in the chat as well, or resources, that there's also a potential, I don't know if I'm going to get the name right, a study, but something to connect you all as either a mentor or a mentee. That could be a really valuable experience as well. Also different library groups. So I know around here they have mahjong groups, they have gardening groups, all that come from the library. Also different lecture series, museums, orchestra or concerts, comedians, Arts Philadelphia. I know, again, it says Philly, and those of you not in Philly are probably thinking, Rachel, why would you include that? But Arts Philly has some really wonderful virtual programming. All of their programming is designed specifically for people living with dementia and their care partners. So that could be a really wonderful organization to check out as well. And that link is also in your resources. Also more or less active engagement, things like watching. So watching kite surfing, watching local sporting events, going to watch the grandchildren play their local soccer game, sitting on a bench outside of the dog park and watching the dogs run around. These are also great activities that can allow us to engage in a sensory oriented way. If we're feeling more fatigued, having more difficulty with our mobility that day, these are things where we can still participate in our world and in things that are meaningful to us, but don't necessarily have to actively do the activity. So you don't necessarily have to actually run around with the dog in the dog park. You can sit outside on a bench and watch the activity. Also, things like nature walks can be really valuable as well. Okay. And I also want to give a shout out to Brandy Hackett and Tori Ricci. I hope I'm saying their names correctly, with the LBDA, for sharing these additional wonderful ideas about activity engagement. So they shared, a few other thoughts on using friends and family. So finding creative ways to stay connected, modifying by using technology, different meeting locations or events, giving more specific feedback on the importance of maintaining relationships. So oftentimes different friends or extended family might not want to add more to our plate. So they might kind of disappear. But if we give really concrete strategies about, it would be great if you picked up some takeout from this local restaurant and came over to have dinner with us tonight. That could be a really meaningful way of increasing engagement as well. We can modify celebrations or holidays. Also, different faith-based activities can be really meaningful to many people as well. And then arts programming. And I'm sorry if I'm talking a little bit fast. I just want to make sure I get to all of the content today. And I'm so sorry. I'm going to stop sharing just momentarily. And I'm going to see if there's any way I can get my pictures to work. I don't know why my computer decided to give me a hard time right when I'm doing a webinar with all of you. But I'm going to try to pull up another version of this PowerPoint and see if I have the pictures. If not, you do have the pictures on the resource as a PDF, which is fine as well. So I can also kind of talk. All right, sorry everyone. My pictures disappeared. What a bummer. I think my Mac is just rebelling.
Hey, Rachel, do you want us to share the PDF and you could just go off of that?
If you don't mind, Julia, that would be lovely. Only because I
Yeah,
think the pictures might be helpful for everyone to see. Thank you so much.
absolutely. And so can everyone see those?
Thank you. That's good.
No problem.
And I think we'll go down to maybe slide 16.
Mhm. And then I think I can give you slide control. Here we go.
And I could also, because I still get the PDF, I should be able to pull it up on my own computer.
I can, yeah, make that more full screen.
On. I appreciate everyone's patience. Even did a tech check and everything, and then my computer decided to glitch in the moment. But really what I'm hoping to do here is share some pictures with you just for some additional examples. And then we'll go through kind of what adaptations we might be able to make to maximize that participation. So let's see. And you know what, Julia, I'm going to see if, just for ease, if I could actually pull the PDF up on my own screen, if
Oh,
that's
sure.
with pictures.
Okay. So I was going to say I gave you slide
Um,
control, but sometimes it's hard to access.
I was going to say, I'm gonna take over and share the PDF if that's okay. Hopefully you all
You
can
got
see.
it. I will
Okay.
exit stage right.
Thank you so much for your support, Julia. No.
Absolutely. Happy to help.
Thank you, thank you. All right, so sorry everyone for my tech challenges, but I think we're back on track now. Okay, so hopefully you can all see the PDF that I'm sharing of the slides. So these are just a couple pictures I wanted to share with all of you about what activity engagement might look like at different levels, at different stages. So on the left, this is one of my clients who was functioning at that Allen's level 2 that I talked about, where I talked about being very sensory oriented. So for somebody at this stage or level, usually the maximum activity engagement attention span that we're looking at is maybe 1 to 2 minutes, possibly with great cueing and wonderful environmental support. We might see a maximum of 15 minutes, but usually we're looking at just a couple minutes at a time. So what does engagement look like for somebody whose attention span is 1 to 2 minutes? So for this individual, again, she's very sensory oriented. So she did really well with, this is called a twiddle muff. So she was also someone who's doing some like scratching or skin picking. So this twiddle muff, it's a muff for your hands, but it had lots of different sensory oriented activities on it that she could still engage in. It could keep her hands occupied. And then after 1 to 2 minutes of her kind of fiddling with it, she would put it aside. And that's fine. It's okay for that attention to only last for 1 to 2 minutes. We then, allow her to take a brief break. And then in another couple of minutes, we can place that item back on her lap, and she's likely to engage with it again for a couple more minutes. I recognize that at this stage, it does make caregiving a bit more challenging, as you wouldn't be able to do those what I call setup activities where you set someone up and walk away because their attention span is shorter. Just know that I give you all a lot of credit. I recognize that it's not always easy to consistently increase engagement or maximize engagement by providing those cues every few minutes. But rest is also okay and important. So it's okay to alternate activity engagement, rest, activity engagement, rest. Okay, and on the right, we have a picture of a client of mine who previously was an artist. Her husband said something to me like, she used to always do art, and now she'll say she wants to do it, but she never gets it out. She never does it. So a big thing for this particular client was initiating the activity. So she had difficulty starting or initiating the task. Once we were able to get the items out, so put canvas in front of her, get her oil paints out, get her, I think it's flaxseed oil. I'm not an artist, so I'm not sure exactly what our different components are. But once we are able to actually get all of these items out in front of her, then she can start engaging. So you can see my very lovely green blob at the bottom. So I was able to just kind of, paint back and forth for a few minutes, help her get started, sit with her while we started the activity. And then once she started engaging, I was able to then walk away for this particular client for 30, 45 minutes before she needed another cue to continue to participate or to take a break. All right, a couple other pictures here. So on the left, this just kind of cues me for a story of one of my clients. So on the left here was a client of mine who he was really big into fly fishing. He also, he did have Parkinson's. He also had a behavior, if you will, of rummaging. So he was going through his home and pulling different items from room to room, kind of mixing them up or losing different items. And so when I was able to talk to the wife about, is there any pattern to the type of items he's rummaging, or any time of day that he seems to be rummaging more, there were some patterns to this behavior. So he was typically rummaging items that were most familiar and comfortable to him. So a lot of items used in his fly fishing experience. So what we ended up doing was creating a rummage box for him. So we had a large bin or a large box, and we placed a lot of these important items for him in this box. So things like his reel. He had this kind of binder full of the different craft supplies that you would use to make a fly for fly fishing. He had a beautiful book of all of these colorful fish and colorful flies. We put that in there. He had a tackle box a clear one that we kind of glued shut so he could see all of the different flies. So this was a great activity for him where he could still rummage, but in a way that was more confined and slightly less disruptive for his wife. But also it was an activity that either the wife or the paid caregiver could engage with him. So they could take out the different items, and as he was rummaging through them or moving them around, they could talk about it. They could flip through the different feathers and talk about the different colors. They could flip through the different pages of the book and talk about the different fish or different flies. So again, different ways that we can adapt to still be client-centered and promote meaningful activity engagement, even when maybe attention span or cognitive functioning are impaired. On the right, this is a client of mine who really liked organization. This is a snapshot of his basement, of his tool bench. Clearly to me, he valued his tools, he valued organization. So when we think about activities that are going to be meaningful for him, sorting activities, organizing activities, they're going to be a really good fit. So again, he was a client where we had a great job, or he did a great job of organizing by sorting. So I could say, these nuts and bolts got mixed up. Can you help me sort through them? Sorting activities are also really beneficial for anyone around that level 3 stage. Okay. All right, I hope that all makes sense. Again, really appreciate all of your patience as I switched from the PowerPoint to the PDF here. All right, so safety. We could probably talk for days about different adaptations to maximize safety, but some things that I want us to consider are, is my family member at a high risk of falls? I want to make sure I'm working with the healthcare team. So whether that be the physical therapist, the occupational therapist, how do we identify the safest type of assistive device to make sure that we're utilizing that appropriately to reduce risk of falls? Also, we want to make modifications to the environment for activity engagement as well. So for example, if we know that our family member is impulsive, I've had clients where we really have to limit their internet use because maybe they accidentally give away money, or they start buying a lot of items on Amazon. So we want to make sure that if our family member is prone to things like impulsivity, that we're choosing activities that reduce risk. Also, we want to consider, does my family member have a history of wandering or eloping? Are they still safe to drive? Are they still safe to use the stove or to cook? Are they at risk of possibly putting different items in their mouth? And if so, I need to either A, provide supervision during that activity, or choose an activity that won't pose a choking risk. So adapting activities. Again, I might go through some of this quickly just to make sure I get through all the content. So we're going to talk about how do we simplify the activity itself, how do we simplify the environment, and then how can we communicate effectively. So if we talk about simplifying the activity, I'm going to use washing dishes as an example again here. Sorry for repeating my example. But the first thing we want to think about to simplify an activity is how can we reduce the complexity? How can we make it easier? So we have washing dishes as an example. So how can we make washing dishes less complex and make it easier? We could choose to use maybe only the plates and the silverware instead of more complicated glasses and bottles. How could we reduce the number of steps? Maybe I, as the caregiver, maybe I wash and rinse the dishes and my family member dries, or they wash and I rinse and dry the dishes. So we can change the number of steps that they're engaging in. We can also change the objects themselves. So the size of the objects, the materials that we use, the weight, the color. So for example, if our sink is white, maybe we're going to choose brightly colored plates because that would give it contrast and allow them to see it easier. Maybe a heavy ceramic plate is too difficult to hold, it's too heavy, but maybe a thick plastic plate is more realistic. So again, making adaptations or changing the objects themselves. We could also change the purpose of the activity from the end product to enjoyment. So I know I've already touched on this. I'll just say it one more time, but in this circumstance, it wouldn't matter if the dishes are perfectly clean or rinsed or dry because that's not why we're doing this activity. And then how can we set up and start the activity? So this would be something like we fill the sink with water, we place the soap on the sponge. I know that this might sound extremely simple, but I can't tell you how many times this made an impact and changed the ability of someone to participate. I had a client one time where the wife said to me, you know, he really just, he's always using his hands to wash the dishes. And I keep saying to him, please use the sponge. All it took is putting some soap on the sponge and just handing it to him. So sometimes it's just a matter of a very subtle adaptation to maximize engagement. Okay, so I might go through this one quickly, but if we think about how to apply this to something like puzzles, so reducing the complexity to make it easier. I think I'm going to just go to the next slide so we can get some participation and think about this. So we're going to go to the puzzle poll here in a second. So if we look at these three puzzles, so we have puzzle A, B, and C. Which of these puzzles do you think would be the most complex or the most difficult for someone with dementia to engage in? Yeah, these are great. You guys are speedy. So the majority of you are answering C. Please feel free to continue to chime in if you have a response. Those of you who are answering C are correct. So C would be the most complex. So if I had you kind of reflect on that, why is C the most complex? There's a few different aspects of this puzzle that make it complex, right? We have the number of pieces. So compared to A and B, C has the most number of pieces. So that pretty often most of us recognize that that can make it harder. But there are a few other things that make this harder or more complex as well. The pieces themselves are smaller. And then another really significant factor here is limited color contrast, right? It's all pretty much the same shade. There really isn't a whole lot of color contrast here. So that makes this particular puzzle more challenging as well. So when it comes to somebody with more significant cognitive impairment, I really love puzzle A. So this would be the least complex of all of them. So we have large pieces, we have really great color contrast, brightly colored flowers here. The pieces themselves, I know you can't tell from the picture, but they're nice, big, thick pieces. And of course, there's fewer of them. I'll give a shout out to the company called MindStart. So that's in your resources as well. That's a MindStart puzzle. All of those jigsaw puzzles are developed specifically for people living with dementia. So I'm a big fan of their puzzles. Puzzle B here, of course, would be in the middle. So we've got some better color contrast than C, but still a little bit more complex than A. All right. Glad you all got that one. That was too easy for you. Okay, so now we'll talk about simplifying the environment. So when we think about environment, we really want to think about reducing clutter and visual distraction. So if I use making a sandwich as an example, we can remove unnecessary items from the table or counter. We can consider a plain colored tablecloth instead of one with a pattern. Reducing background noise. So we want to do things like turning off the television or the radio. We want to increase lighting. So consider a tablecloth to reduce glare. Removing dangerous items. So removing sharp knives from visual field, providing only the items that we need for that particular task. So in this case, it would be just the sandwich ingredients or the utensils needed to make that sandwich. And then we also want to consider providing the items within someone's visual field. Okay, so in this case, if we were to think about how do we apply those same techniques to coloring, so we would want to reduce clutter from the table. So making sure we also don't have any background noise, so no TV or music on in the background. Making sure that our lighting is adequate and that we don't have any glare. Removing dangerous items. So again, we want to make sure that the only items on the table are the items used for coloring, and providing those items directly within someone's visual field. Okay, I have some examples I can use to describe that further, but I'm going to hold off and save them to the end if we have time. Okay, we're going to do another poll. So this is looking at environment, or the table in this case. So this one's a little tricky. I get some differing answers, and that's okay, because I can understand a couple different answers for this. But I want you to think about which of these tables would be the best table to do an activity. Let's just say, eating dinner. So which of these tables would be the most appropriate for eating dinner? We're getting a lot of B, fair amount of C, couple A. All right, I'm going to give it a minute while you all still answer. So this is exactly the response I was expecting. I can understand both B and C. My preference is typically B, because we have a tablecloth, so we reduce glare. So that's the really big one that I'm looking at here. I can understand and see that, you know, we have the nice placemats down, which I really like as well. There's a little bit more color contrast because B is a lot of light colors on light colors. But again, the piece I'm really focused on there is the glare in C that I would want to reduce. Of course, table A is a bit cluttered. So this would be pretty confusing for any of us to know what it is that we're supposed to do at that table. So my point here is anytime we can set the environment up to look like what it is that we're supposed to do, that can help enhance engagement. And I am going to tell just a quick little story about this. So I was, sometimes I peruse like caregiver Facebook groups just to see what things are coming up. And I remember one time a care partner wrote down, you know, it's a really challenging day. Mom forgot how to eat. And then I read more about it, more context. And she said that she sat down next to her mom. I think she may have had a video or a picture. She sat down next to her mom, and, you know, the mom had a napkin with a cookie, the mom was actively coloring. That's what it was. Mom was actively coloring. The daughter handed her a cookie, and the mom started to color on the cookie. And understandably, the daughter was really upset about this. But I think what we have to consider is the environment and the context. I am pretty sure that if we had adapted that environment to look like it's time to eat, that we would have seen a shift in that mom's ability to eat the cookie, right? So if we had taken away the crayons, if we had taken away the coloring papers and set the environment up with a plate or a napkin and maybe a cup of water, and then place the cookie, and maybe even had someone sit next to her and eat a cookie, right? So increase the social engagement as well, that we would see increased engagement in that task. Okay, I hope that makes sense as well. Great. All right. So these are just some things for us to consider. Again, these might be a few things for you to think about even after our presentation today. But I like to think about anytime we have an activity, we can adapt it. We can downgrade it, meaning make it easier, or we can upgrade it, meaning make it harder to match our abilities or our family members' abilities. In occupational therapy, we call this the just right fit. So we're trying to find the just right fit for the task, for the environment, for the social demands. So my sisters and I really love jigsaw puzzles. So this is us doing a jigsaw puzzle. You can see there's a lot of complexity here, right? We have glare. I don't know if you can see, but there's like a remote on the side here. So we have music playing. There's a lot of us walking around a table. There's a lot of pieces here. So there are a lot of things that we can do to downgrade this scenario. Maybe there's only 2 of us working on the puzzle at a time. Maybe we choose an easier, smaller puzzle. Maybe we have it on a tablecloth so there's not glare. Maybe we turn the music off, right? So there are lots of things that we can do to enhance engagement. Okay, I have a couple pictures here where I thought maybe we could chat about ways to downgrade. So like socially, looking at FaceTime, this is a large group. So different ways to downgrade would be, again, maybe one-on-one or maybe just 2 people. Maybe the phone is hard to see, so maybe an iPad would be a little easier or larger. Picking blueberries. This one I was just partial to because I was doing this the other day in Vermont. So picking blueberries, great fun activity, but maybe we consider what's the temperature outside. Maybe instead of standing the entire time, maybe we bring a wheelchair and we're seated for part of the activity. So again, we can make these adaptations to still allow for meaningful activity engagement. And then we have communicating effectively. So anytime we think about activity engagement, we can enhance engagement through the way that we are presenting an activity. So we can use statements instead of questions. So if I say, would you like to do this? The answer might be no. But if I say, come join me in this activity, I might have a higher likelihood that that person will participate with me. Also, when we look at options, typically I like to say offer no more than 2 choices at a time. Again, that could vary person to person. And then typically we like to just focus on a couple steps at a time as well. We also like to acknowledge what the person is saying and go along with their belief of what's true. Again, I think that might be a longer discussion. We could talk about that in the context of hallucinations, but that might be a webinar for another day. But if there are specific questions to that, I can certainly address that at the end of today as well. So communicating effectively, again, we can redirect our family member if they start to become agitated. And when I say redirect, we can redirect into a different activity. Or my kind of go-to for redirection, which is both meaningful activity engagement and usually fairly easy, is reminiscing. So if I have a client who seems to be a bit frustrated, upset, anxious, I usually ask the care partner to think about a story from either when they were younger. So if it could be potentially childhood or early in their marriage, or when their mom was raising them, something from the past, and try to think about a story that evokes a really strong positive emotion and paint the picture. So anytime we can reminisce, really tap into long-term memories and think about things that are really positive and meaningful, that can help reduce a sense of agitation and anxiety, and can a lot of times help us refocus so that we can try activity engagement in a different way. Use words of encouragement. So this can just be as simple as a thank you. I use thank you all the time with my clients. So thank you so much for your help today. Thank you for your willingness to do this with me. Thank you for spending your time with me. Those are really easy, kind ways to keep people engaged. I'm sure you've noticed I'm not always the best at this one, but speaking slowly and allowing our family member enough time to process and respond. I know I'm speaking quickly, so thanks for bearing with me. And then also looking directly at our family member when speaking. So instead of talking to them from across the room. We also want to think about how we can use cues. So we can use visual cues. Those are things like different signs. So the examples that I have here are socks or stop sign. We can also demonstrate the activity. That's like the example I gave where I was painting with my client. Verbal cues are anything that we say, And then tactile cues are touch cues. So that might be just a simple like tap on the hand to help initiate that person bringing the spoon to their mouth, for example. Okay, and some general considerations. So the importance of routine can be really beneficial for people living with dementia. We ideally don't want to rush the activity. This concept of relax the rules. So again, I know I've said this multiple times, but the important part is the engagement or the enjoyment in the activity. It's not really about, did they paint this correctly? Did they play the card game right? Did they fold the laundry well? We're not worried about that. We just want to enhance quality of life. Also enhancing comfort. And sometimes it can be helpful to create an activity box. So then that way, when you're stuck, you don't have to brainstorm a brand new activity. You can just kind of pull from a box where you've already put some items in there. And then that way, if they're not interested in one, you can just pull another one. All right. And then barriers to engagement, I think we'll wrap up with these concepts so I can make sure I get to the Q&A. So what are some barriers to activity engagement? So lack of time or support or assistance, and then resistance. Sometimes we also see apathy or depression or withdrawal. So in terms of time or lack of support or assistance, again, I think the LBDA crew gave some great ideas about how we might be able to tap into other supports. So how to ask family and friends for the help that's needed, how to tap into possibly faith communities, how to look into being a mentor or mentee. Those types of things could potentially help with this as well. And then also the idea of resistance. So this again could be its own topic, resistance or apathy, but I want you to think about what's the root cause. So if the person is resistant, if they're saying no, why? So what's going on within them? Are they uncomfortable? Are they experiencing pain? What's the temperature in the room? Are they overstimulated, fatigued? Do they feel a sense of loss of control? Are they always fatigued or apathetic at a particular time of day? Again, what's our communication style? Did we approach them in a way that reduced resistance? Are there environmental triggers? Are there a lot of people in the room? Once we figure out the why, so why are they resistant, then we can adapt the situation or the task or our communication or the environment to help reduce that trigger. So again, we want to think about, do they feel safe? Do they feel in control? Are they comfortable? If someone is experiencing apathy or depression, again, trying to meet them where they're at. So we don't want to be forceful with participation, but we can encourage engagement through the type of communication style that we're using, or again, maybe starting with some of those less demanding tasks, like listening to music, like tapping along to music, like telling stories, reminiscing, things that could potentially stimulate them so that we can increase engagement in more active activities. All right, sorry for rushing through the end, but I hope some of this information has been helpful. I also am hoping that you might be able to apply these concepts to your own family member. So there is a handout that you can access that you can use at any time. So I want you to think about, why would you choose a particular activity? How could you simplify the task? How can you simplify the environment? And then how might you communicate differently to enhance engagement? Here are some of those links, but again, Rose kindly put all of those links for you in the resources tab. And now we can get to questions. So Julia, I'll have you come back and tell me what we're going to answer.
Excellent. Great job. That was fantastic.
You. Sorry again for my tech challenges.
I love computers when they do what I want. And you guys, let's use our reaction buttons at the bottom. Some of you are doing some to show some love for Rachel. It was such a great job. So much good information. And just a little note to you, there'll be more publicity about this in the future, but we're going to be putting up some videos on the Lewy Learning Center with Rachel in November for Care Partner Month, of her going through some more specific things. So kind of tackling some of these issues a little bit more specific. She was trying to give you the broad lay of the land planned and did a beautiful job. So thank you so much. All right. We did get some good questions. So let me pull this open here and start. So we got a couple. We get so many questions. I try to kind of couple them and group them together. So definitely we know that the underpinnings of a lot of the cognitive issues around Lewy are attention based. So then they can be overstimulated really easy. Or one person commented that like trying to go out with friends or have, engage with like multiple people can be really difficult. And so some things that I put in, and I'm excited to hear what you have to say too, was for restaurants, you guys, something that I used to tell my clients is to pick a really quiet restaurant if you can. The ones right now that blare music, I feel really old in them because I'm like, turn that down.
Same.
Because I can't hear what the people I'm with are saying, and I have a hard time attending to the conversation. Some restaurants will have a private room or a quieter room that's offset from like the main dining. You could ask to be seated there. Often, too, if you can find a table, maybe where the person kind of faces toward the corner of the table rather than facing out to the restaurant, that can be helpful too. And then a lot of it comes around kind of educating and not training your family, but helping them understand that slow cognitive processing and not because we all tend to kind of, which Rachel and I will probably start doing here in a moment, some,
I was gonna say
but
same with me.
trying to slow your roll a little bit and ask some questions. So, what other ideas do you have around people getting like kind of sensory overwhelm or things like that?
I think all of the points you made are fantastic, Julia. The other thought when it comes specifically to restaurants is looking at off-peak times, right? So maybe it doesn't have to be we go at the dinner rush. Maybe we go for lunch. Maybe we go in between lunch and dinner. Those are times when typically restaurants are a bit less crowded. Um, and I think, again, just hitting on all of the points that you made, we do often have to think about overstimulation and having rest, having appropriate rest. So that also means that if we know that we're going out for a meal with friends, even if we've curated a perfect environment, we want to make sure that leading up to it, that we're not overstimulating with more activity, right? So it means that maybe we have a calm afternoon, not a lot of activity before we go to the restaurant. And then also on the other end of that, making sure that after the restaurant, after dinner, if that's what we're choosing to do, that we have a calm evening plan. So we're not stacking, back to back appointments. And then, okay, well, we just went to the doctor and that was stressful. Now we're driving in the traffic and then we're going to end up at the restaurant. That would be a lot, right? So really thinking about how can we adapt our routine during the day to facilitate a calm environment as well.
I think that's a really good piece of advice too, because that fatigue component in there too, that's absolutely and we don't think about it. Life is busy. We want to do everything. So absolutely. All right. We have another question here, and I'm not sure if this is something that you want to just provide resources offline. We can do that. But a lovely woman asked if there are any websites that would be appropriate for a man who's a level 4 who loves to spend time on the computer.
Ooh, great question. That might be one that I might want to think about a little bit. So I can also follow up. I would say when it comes to it probably depends a bit on his interests as well, right? So like what are
Yes.
things that he typically likes to do on the computer? I do have a personal favorite, but this does require a bit of like searching and adaptation. There's a lot of quiz websites out there, so like trivia or quizzes. One of them that I love is called Sporkle. It is not specific to dementia by any means. It's just been a fun pastime of my own. But that one we can really, there's so many different trivia games on there. We can usually find one that's a good fit for our family members' interests. And they have lots of different styles of trivia or quizzes. So we can find one, maybe they do better with picture trivia versus typing or words. So there's lots of different ones we can adapt. So that's the first one off the top of my head. But again, I think it's also important to think about, well, what does he like to typically do on the computer? Does he like to play, solitaire or mahjong, or is he more into watching videos or that type of thing? So we might want to take the interest and then kind of work backwards and adapt. But I will brainstorm if there's any general websites that are good ones.
Absolutely. I think the interest point is absolutely spot on. And some favorite ones of some of my patients, I had a gentleman who loved art, and the Van Gogh website in Amsterdam has a beautiful kind of like these different ones that I think you guess if it was, you guess kind of who the artist is, I think, or things
Oh,
like
wow.
that.
Oh,
Yeah, that one was a favorite. And then I had another gentleman who loved like muscle cars and like Corvettes. And so we found some really good websites on there with, different years of cars and things he could look at. So I think interest really drives it the most. And then you kind of try to find the just right fit.
yeah.
Absolutely. It's so fun though to try to find. And then I used to find some really good ones too. And we did put you guys in the chat because I know you commented on reminiscing a link for the Legacy Project, which has a lot of great resources for life stories, for reminiscing, for different activities and guides to do. So take a look at those too. So let's grab another question here. So this individual's dad has some motor symptoms. So he has Parkinson's disease, dementia, and so he has some tremor, and he liked to putter around the house and kind of fix stuff and repair things. And she said he just basically stays in bed all the time now. So, what are some ideas for things to maybe get him engaged?
Yeah, another fantastic question. So, again, it can depend on the severity, if you will, of the motor symptoms. So, even though someone has Parkinson's and motor symptoms, it doesn't automatically mean that they can't engage in anything that would require, physical mobility. But again, we want to think about how can we adapt it to try to make it easier cognitively, but also easier physically. So in that case, we want to think about most likely we want things that aren't as don't require as much fine motor coordination. So probably not as many like tiny little pieces and things. I'm not sure if they still do this. I might have to follow up on this, but at some point, especially during the height of the pandemic, I think it was Home Depot or Lowe's was doing, and I say this with compassion and not to imply that people living with dementia are children, because that is not the case. But they had certain workshops that were more geared towards children, but you could actually have them mail the package of materials to your home. And oftentimes those projects were a little simpler. So didn't require as much fine motor coordination and still had kind of the building or tinkering element that a lot of people, especially men, maybe often were doing prior to dementia. So it's possible to look into some things like that. Again, I think fine motor coordination is probably one thing that we're going to try to avoid. That's my guess. Otherwise, things that don't require quite as much strength. But again, we can even look at how can we use familiar items and just adapt what it is that we're doing. So if tinkering or building is still hard, could he still sort through things or rummage through things? So maybe the items themselves are just larger items. So maybe nuts and bolts is not realistic for him, but maybe we have I don't know, maybe there's like a box of old tools that we found at a garage sale. Could we have him sort through and find the ones that he would want to keep, or put the screwdrivers over here and the hammers over here, that type of thing. So there might be ways that we can still use familiar and meaningful objects and just reduce the complexity even from a motor standpoint as well. I hope that answers
Absolutely.
that
Oh,
question.
that's great advice. Thank you so much.
Of course.
Okay, so this is a really interesting question because I do see these around a lot. So do you think it's a good idea to give a baby doll so their mom has hallucinations about babies and taking care of babies?
Okay.
So any thoughts about that?
Great question. Okay, and this is another one where it's tricky for me to answer as a blanket statement because it could really depend person to person. I've had some clients where, a baby doll has been so meaningful. It's increased participation in a variety of different areas of their life. They feel as though they're really tapping into their motherly instincts, allowing them to care for something. So it could be really meaningful. For other clients, it may either feel childish or, again, it could potentially be a trigger for hallucinations. And I think even within that discussion, and Julia, please feel free to jump in if you if you have any other thoughts. Um, but I think it would also depend on what is the impact of the hallucination. For example, if she's hallucinating and children, but it's evoking positive emotions, I don't know that it would necessarily be enough to deter me from saying, yeah, give her the baby doll if it makes her happy. If she's hallucinating and it's causing her anxiety and agitation, then I would maybe say, okay, this isn't the right fit for her. Would you agree with that?
I completely agree. And that's the thing, I had one of my, well, actually my first patient ever when I was doing my clinicals at Mayo had Lewy and had a lot of hallucinations, and they were around babies, but they weren't frightening at all. And the interesting thing too, you guys, and we're going to be talking more about psychiatric symptoms in October coming up. But a lot of times they have insight into their hallucinations, not always. But I remember when he was talking about the baby that was crying, he said, well, I know it's not actually really there. And so, I think that you would just have to try it with a baby doll and see how she responds. Like you said, if it's upsetting, then no go, but it might bring some comfort. And I think then, it is a cheap thing to try. At least they're not expensive.
Exactly. Remember, I had one client who I will never forget, where resisting bathing was becoming a really significant challenge. But she loved her baby doll and carried it around everywhere with her. And we were able to kind of use that as a motivator, if you will, or strategy to promote bathing. So by saying, like, we've got to get your baby washed up, she needs to get clean for the day, then she was able to get a shower without resistance. So sometimes it can be a really positive and meaningful experience in a variety of realms.
Absolutely. Absolutely. But definitely there's no one right answer. That's
Never
the
a
and
one size fits all approach in dementia, right?
and as Rachel noted earlier, especially with the cognitive fluctuations, it might work one day and then the next day not, or maybe it works 1 minute and then not the next minute. So it's a moving target at all times. It definitely makes it tough. So here's a great question about reading the newspaper. So she says her mother still enjoys reading the newspaper, but gets very frustrated about how much time it takes her and her inability to finish before the next day's paper comes. Do you have any advice?
Oh, that's another fantastic question. Okay, so I have a couple of thoughts that come to mind. One is, there is a newspaper called the Resense Register. That's a newspaper designed for people living with dementia. Again, this would depend on the degree of cognitive impairment. Your family member might feel as though, she's like, what is this? I'm used to reading the daily news. For other clients, this might be a really meaningful way of engaging in reading the newspaper. It's not as long, the font's a little bigger, the content is generally less anxiety producing. They're typically like happier bits of information or bits of news. So that might be one way of still allowing her to engage in reading the paper, but maybe in a way that doesn't upset or frustrate her. Other things that we could do are, and again, I say this with compassion and love, but maybe adapting the paper before we hand it to her. So if the entire paper is too much for her to get through, could we pull certain sections out before giving it to her, so that she can still feel as though she's getting through some of the information, but maybe we're, again, that's a way of kind of downgrading the task, if you will. So hopefully she still feels that sense of accomplishment before moving to the next day. Those are a couple maybe simple things to try. Again, it's going to depend on how your mom reacts to that and her level of kind of awareness of the content of the newspaper. I hope that makes sense.
Yeah, yeah. And some other things too you could think about. I know with my Louis folks, sometimes pacing out activities like that through the day was helpful. So if you're doing a daily routine, you might kind of think about maybe she reads the front page, with breakfast, and then maybe before lunch, reading another section and just kind of chipping away at it. But in our visual function resource that we have, you guys too, a recommendation that they make a lot of times is even just printing out articles to read, because those pages that have a lot of different articles on them can be really distracting. But if she's somebody that loves the feel of the newspaper, and everything, she might not want that. So you'll just have to think, maybe try some different approaches, but all really good suggestions. Excellent.
Actually, I love the idea of printing out articles, because even think about like how hard it is to try to follow one article you're interested in. Like, okay, I've got
Yes.
other
And
sections.
where did it end up on the back page, or for
Yeah.
sure, for sure. Okay, we've got another question here. So, when helping with an intellectual activity, so like they're doing computer banking, right? They're pulled in two ways. So, demanding more increases tension, but it forces more active participation. And the opposite is more efficient, less stressful, but it's more passive. So, what do you think is a good balance if you're kind of, working on some of those more difficult tasks?
Yeah. Another question that I know this is going to sound like a broken record, but it depends. So I think it's really, again, all about that balance. I think it depends on what were we doing before this particular activity? What do we have planned after this particular activity? So it's all about the big picture. What's the context? So for example, if we've had a really low key, kind of boring day, it might be a good day to try to push a little bit further and let's see if we can really maximize engagement in this particular task. Let's say we have a day that's really stressful and overwhelming. We've had a lot of things going on. That's probably not the day where we're going to kind of push the boundaries. We're going to opt for a more passive activity. So I do think really considering what's the activity beforehand, what is the activity after, also what are the necessary demands. So do I need this person to be present, to be able to socialize after the activity? Okay, then I'm going to reduce the demands of this particular activity. So I think that's usually how I kind of judge how hard am I going to push or not. I'm also someone who will always opt for quality of life. So if I feel as though a particular activity is causing stress, agitation, it's impacting their quality of life in the moment and afterwards, I'm usually going to say, "Nope, let's just downgrade it, make it easier, and enjoy life." So again, I think there's different circumstances for different types of activities, but that's probably my default.
Well said. Well said. We'll let that be the last word since we're running out of time. But this was such a great conversation. Thank you so, so much. And so, you guys, we'll look forward to seeing more from Rachel on the Lewy Learning Center. And on behalf of the Lewy Dementia Association, I'd like to thank you all for taking time out of your day to join us. And I also want to thank Rachel Wiley for sharing her amazing expertise and experience and guidance with us. Thank you so, so much.
Thank you.
As a reminder, oh, anytime. Absolutely. We'll have you back more, I'm sure. As a reminder, you're going to receive that email in about 1 week with a link for the recording of the presentation and also the resources and links that were mentioned today in the webinar. We invite you to visit that landing page to see what's coming up next and stay informed about our upcoming content. And mark your calendars to join us Tuesday, September 17th. I think she might even be online. We are going to explore how to find a mindful path to resilience with the amazing Angela Lunde from the Mayo Clinic. You will not want to miss that session. So, thank you all so much for your time and for your attention today. And we'll see you again in September. Take care.